registered nurse for 32 years. I worked in emergency, medical, surgical, 15 years in pediatrics, and the last 15 was in the NICU. I mean, I can resuscitate a baby born at 26 weeks, and that's something that not everybody can do. I love being able to use the skills that I've been given to bring life into this world.
I was a registered nurse for 31 years. My specialty was working with wound ostomy continence clients, which there are very few of us in the province of British Columbia.
I was a vascular surgeon at the Vancouver General Hospital for 32 years. My specialty deals only with blood vessels. In addition to that, I've been on faculty for the University of British Columbia Department of Surgery. I'm a full professor.
I'm a family physician and I've been practicing for about 26 years. In addition to my family practice, I was also doing long-term care. I had the privilege of being a medical director at one of the facilities where I was, and it was just a real privilege to be able to work with that population.
You know, when the pandemic hit, it was nobody knew what was going on, but I was a bit of a skeptic. Some of my skepticism probably relates to the fact that I'm a scientist who does research, and we're skeptical people. Because of that, I questioned why they thought they could produce a vaccine, which typically takes about 10 years to produce, within 6 months.
I went home and I said to my husband that day, I think I'm going to choose to be fired because of what I'm seeing at the hospital. Already in September of 2021, we were seeing the side effects of this vaccination.
I was told that our staff had to get the injection, and when I got it, it didn't hurt going in, but immediately afterwards, I had pain in my arm, I had lost mobility in my left shoulder, I couldn't put my bra on, unclip it or clip it myself. I lost my fine motor skills in my hands, and then being on post-traumatic stress disorder, because that's how I had to take a time out. I never missed a day.
I just held back because I was very uncomfortable with the whole idea, knowing that in fact there was no long-term data whatsoever.
I approached one of my manager and I said, so at this point, like I'm a week away from losing my job and we have an outbreak. I said, I'm here still about to lose my job and I've been working so much of overtime, never call in sick, comply with every protocol you gave me, and I am negative and I'm about to lose the job. I said, where is the science behind? And they said, we just follow the rules, we just follow what we've been told.
I talk to my coworkers here and there, and they are also confused as to why I can't come back. There's visitors allowed in that don't have to have what I have to have, and they've even allowed cuddlers to come back into this, which are strangers to babies that just come and hold these babies, but they don't need to have this either.
Police and security ushered nurses out, and there was no replacement for them. So there were units left without nurses. We're watching the news about the lack of care, about people dying waiting for an ambulance, people dying because they can't get life-saving surgeries, people in emergency dying in a waiting room because they don't have nurses. Here we are sitting and we're not allowed to go and help these people.
It's so cruel. It's so cruel what's going on with long-term care and how these people who need just someone to be there and show them that they're worthy of care, they're worthy of human interaction.
These unvaccinated healthcare workers are working all during COVID. They're all highly experienced. You would discard them. You would claim that it's only 2,500 official healthcare workers who are unvaccinated and are not working. But in fact, that is not true. Like myself, who took early retirement, the early retirees do not appear on any statistic. It is estimated that the total number of healthcare workers is probably about 2 to 3 times the 2,500. So you're talking to me about 6,000 healthcare workers. You could probably staff a fairly large regional community hospital, I would say Kamloops or Kelowna, just like that.
So there is a lawsuit going on called a judicial review, and it's to ask the judge to review the reasonableness of the mandates. And where's the science that backs up the mandates? And where's the science that shows that people who've chosen not to take the COVID-19 jabs are a risk and should not be allowed into facilities? There are so many studies that show that, and to be honest, like, you don't even need to be a scientist or read the studies. You just know from people that you encounter in the community. Everybody knows that the vaccines do not prevent infection. The vaccines do not prevent transmission. Everybody knows that natural immunity is effective, and there are studies that show that there's long-term effectiveness.
I want Canada to know the truth. I want Canada to understand that they've been lied to. This is so corrupt. This is so wrong.
Back in the Philippines, we disposed a dictator back in 1980s. What's happening in Canada right now is typical of what I have experienced. And I never imagined in my lifetime that I would see again the oppression, the tyranny. But the good news there is the voice of the people disable tyrants.
That story would replay in my mind for such a time as this. I put you here, and you're my servant, and until I say otherwise, you're gonna do what I've asked you to do, what I've called you to do, and that's to be the truth, to be the light in this place.
I believe that courage begets courage. If you don't stand for something, you will fall for anything. And I think as Canadians, we know what that something is.